Hi, I'm Stephanie Furler, the CEO of the Royal Hobart Hospital Research Foundation. We're a health research charity. We fund medical research here in Tasmania. We were established in 1997 and since then we've granted over $10.5 million to medical research projects to support the health and wellbeing of our community. What's really interesting about research here in Tasmania is we've got one health system and one university. So clinicians often work across both and researchers work across both systems. So it's a really unique position we're in where research is really top of mind for a lot of people. We're an island state, so our research is focused on supporting our local community. We also have a lot of genetic variants within our state and it makes research easy to study. So one of the research projects that we're looking into at the moment is childhood cataracts and the gene variants with that. And so because we've got 3 families with these childhood cataracts, we're able to easily study them, see what the gene variants are, and then that research can be rolled out around the world. So it's pretty interesting that we have such a small population and we can study this research in a confined space. We fund medical research that supports the Tasmanian communities. So we have research across a broad range of fields. So we do cardiothoracic, neurological conditions, premature babies, anything that really impacts our local community, that's the research that we support. Some of the more targeted research that we've done over the years is treatments into JackJumper bites. So JackJumpers are little ants. They're quite aggressive when they bite people. Most people are fine, but often at times it can give people anaphylactic shocks. So the research that we looked into was developing new and innovative treatments for these bites, and as a result they've set up a desensitisation clinic at the hospital, which has significantly reduced deaths over the years for people who've got this kind of reaction to these type of bites. And so that's something that's really targeted towards our community that we're proud to have supported. A lot of our research supports people within Tasmania, but it has far-reaching impacts around the world. One of the research projects that we've supported early on was called the Hobart method, and it was a research into developing new treatments for delivering care to premature babies. So this took off, it was really successful. It's now been rolled out to 33 neonatal clinics around the world. More recently, we've been doing research into blood pressure testing. We've obviously engaged patients here in Tasmania, but we've also engaged patients across China and Italy and other centres around the world. So it's a very collaborative approach that we're driving here from our small island state.